Landmark articles in neurology that you should know. Not all clinical trials are positive. And in fact, I think that we can learn a lot from the negative trials out there, especially from the study behind me that we're going to be talking about today, which is the AFFINITY randomized controlled trial, which evaluated the safety and efficacy of fluoxetine for functional outcome after acute stroke. First, let's talk about why fluoxetine. So the article cited 2 preclinical models in animals where fluoxetine had neuroprotective and neuroregenerative effects after acute stroke. They also cite the FLAME trial, which showed in 118 patients that fluoxetine significantly improved functional outcome at 3 months after stroke. The authors here also cite a systematic review that looked at 52 articles evaluating the use of SSRIs after stroke, and it concludes that the answer to the systematic review was not definitive, as there was too much heterogeneity amongst the 52 articles. And that brings us back to the paper today, where they randomized 1,280 participants that had an acute stroke within 15 days and assigned them in a 1-to-1 fashion to either 20 milligrams of fluoxetine daily or placebo. The primary outcome was modified Rankin Scale score at 6 months, and there were no significant differences. However, the patients in the fluoxetine group had an increased risk of falls, bone breaks, and seizures.